Hello, my name is Susan Butler. I am an oncology nurse at the Merle Cancer Care Center at Island Hospital in Anacortes, Washington. Today I'm going to talk to you about what you need to know about taking oral chemotherapy. Oral chemotherapy is a medicine you take to fight your cancer, but instead of it going into a vein or through a needle, you take it through your mouth as a pill or a capsule. Oral chemotherapy can give you more freedom to carry on with your daily activities and with your life, but it's important to know how to safely handle and care for yourself during oral chemotherapy treatment. There are several things important to know about taking oral chemotherapy. First, it is important that you take oral chemotherapy exactly as it is prescribed. Some medications are absorbed better when they are taken with food, some are best when taken on an empty stomach, and it doesn't matter for others. Ask your doctor or pharmacist when it is best to take your oral chemotherapy medication. Also, there can be dangerous interactions with other medications, supplements, and some foods. Make sure to have a conversation with your doctor or pharmacist to learn if there is anything you should avoid while in treatment. It is important that you not start or stop any medications or supplements without checking with your provider to ensure there are no concerning interactions. Next, it is important to know how to handle and store your oral chemotherapy medication. Make sure you know if there are any special storage requirements, such as temperature or light exposure. Many chemotherapy medications are toxic to handle. Unless you are told otherwise, do not crush, chew, or cut your medication. Do not allow others to handle the medication with their bare hands, particularly pregnant women or children. Do not leave chemotherapy pills out where children, other people, or pets might get the medication. If someone else must help you with your oral chemotherapy medication, then they should always wear gloves. Always thoroughly wash hands and any surfaces or containers that had contact with the chemotherapy medication. While you are on oral chemotherapy, your body fluids will have active chemotherapy in them. Make sure that if you bleed, vomit, etc., people who are helping to clean up are wearing gloves, and that surfaces and items are washed thoroughly with soap and water. Close the toilet when flushing after use, and if you end up hospitalized, make sure the healthcare providers caring for you know that you are on active chemotherapy treatment. Oral chemotherapy can have side effects. Because you may not be coming into the clinic as often to see your healthcare team, it is very important for you to know what the side effects are and to notify your team if you start experiencing them. It is essential that you take your oral chemotherapy medication as prescribed and that you not miss a dose. Make sure you keep track of when you need refills and get them filled before you run out to prevent missing any doses. Ask your provider before you start your oral chemotherapy treatment what you should do if you end up accidentally missing a dose. Also, make sure you call your healthcare team if you become ill with vomiting or diarrhea, as you may not be able to keep your oral chemotherapy medication in your system long enough for it to be absorbed and to take effect. Thank you for listening to the Merle Cancer Care Center's Oncology podcast program on what you need to know about oral chemotherapy. For more information or to schedule an appointment, call the Merle Cancer Care Center at 360-299-4200.